This is an adult gentleman who has cerebral palsy, alert and oriented, such a nice gentleman, and I actually got to meet him. He was in a different state, and I was there with the fitter that went into that nursing home. His sister was with him, and he was such a patriotic gentleman. It was about a month before the 4th of July when I met him, and that was that first picture, and he had on this shirt. And so we talked to him about what we wanted to do. You can see his curvature. It's hard to see, but his left hand is blurry, and that was because he had such spasticity in that hand and continual movement. And when he was trying to get his words out and would get excited, then it moved even faster, and it would rack his body. And he said what bothered him more than anything was he wanted to be able to go to the dining room and eat and not be humiliated, to be embarrassed, because he would sling his food and it would come out of his mouth, and it's something we don't have to worry about. And again, for all of us that have worked in nursing homes or do now or will in the future, we need to make sure we don't look at that as normal, because we have a lot of patients that do have problems eating, but we need to see what we can do. You have to have the tools to do it. So let's see what we can do to help their quality of life. But he told his sister he wanted to make sure she had that shirt washed and ironed and in his closet for each time he got his picture made. So it was about, actually the week of the 4th of July is the middle picture, and that was his initial fitting. Now there's several things I want you to look at. One is that his hand is not blurry, so it wasn't doing that a continual movement. But I want you to look at his left eye, his nose, his mouth, and his left jaw. You see, they almost look deformed, and you really didn't notice it in the first picture. But we're changing something. We're doing something different with his body. And neck is definitely central nervous system. You've got a lot of vital nerves there. So notice the angle of his shoulder. Notice the difference between his ear and the shoulder. And that way you can kind of get a perspective on it. In the last picture that was taken about a month after the initial fitting, now I want you to look now at his left eye. His nose is starting to straighten, mouth looks more symmetrical, and his jaw is even starting to straighten up. And again, his left hand is still. This is amazing. And back to the initial fitting, this fitter is just a wonderful person, and she waited until the end of her day to fit this gentleman so she'd be there about time for his supper. We call it supper in Kentucky. You may call it dinner in other parts of the country. But she went with him to the dining room and sat with him while he ate. And he was so thrilled because he didn't sling food and wasn't humiliated and embarrassed. So that's huge quality of life. This lady, actually, I wish I had the original picture. The reason they wanted us to look at her was her wrist was so tight in her trachea, they were afraid it was going to have cause a problem with her breathing. And of course, definitely a problem with eating and all, with everything going on in the neck. But we'd actually done some massage on her and had her elbow down somewhat, but it was because her shoulder was up, her elbow was so tight, and then she had this pushing in of her trachea. So this is about 15 minutes after her initial fitting. You'll see she had quite a bit of relaxation with that elbow. One of the other things, this is the NeuroFlex Restorative Flex elbow, that when it opens your arm, you get free flow of oxygen and air to that antecubital space. In the before picture, you see skin on skin. If it's kept like that, or allowed to stay like that long enough, you can actually have skin grow together. Skin is not like a piece of wax paper or leather. It's living cells. And if you have moist, warm environment, they can eventually, it can grow together. And to open that up, you could actually have to have a surgeon do an opening there to actually cut it open. Then you'd have wound care, and then you would have to open it up. So if we can get to people here, then the skin can actually change as we're opening up. But it isn't unusual to open up somebody's elbow like that and see a slit or some type of wound, some stage of wound. But usually in about 30 seconds, a minute, if it's pink and angry, and it'll be sweaty, it'll dry, and you'll see that skin start to normalize. So you know you've caught it in good time, but it is vital to get airflow to that joint. This is just 3-point leverage. You have leverage here, here, and here. So it's like you're doing range of motion. It's very comfortable. It has the flex technology. And then we needed to work on her hands too. But do you see how you can position her so much better in her chair? This tends to pull you sideways, so it has effect on your spine also. By bringing it out and bringing that elbow down, then her shoulders can start to come up and her spine be in better alignment. This is little Miss Alexis, and Mom brought Alexis in. Her dad is in the military, so while he's off helping protect us from bad people, Mom has the primary responsible of this sweet little girl. She actually had her head down, and before we took the picture, Mom said, "Lexi, raise your head." So you see the strained look on her face? Now, there's several things that I want us to hone in on here. Number one, you have normal curvatures of your spine. The C-spine should be shaped like this, your thoracic like this, your lumbar like this. So with these patients that their head are forward all the time, especially in children that they're still developing, you're changing the curve of their neck to be like this, which is, you have all those vital nerves, spinal nerves coming off your spinal cord, so that's very scary and dangerous. You also see the shoulders coming forward, so you know she isn't getting good lung expansion. You see the proverbial drool rag, the bib, which these patients all have to have because they continue to have saliva that they're losing. And you think about it, these people are hard to keep hydrated. They don't take in enough fluids. Then they're typically mouth breathers. And you add some loss of saliva from drooling, you have a real potential for dehydration very quickly. And that can be an emergency situation. You have to be hospitalized on IVs, and parts of your body can actually shut down. Well, in looking at Alexis, it seemed the biggest culprit was her elbows, and I should have pushed the sleeves up a little better, but the one on the left was actually hyperextending. The one on the right was stiff in extension. She had a lot of tone in her wrists. Fingers some, thumbs some, but mainly tone in her wrists. And her elbows just felt rock hard. Some people might have even, the old years ago, might have even thought they were fixed. All we did was fit her with little hyper hands that molded to just put slight tension on her wrists. We didn't try to straighten them up. We just put low load stretch on them, but allowed them to flex through that tone. She very quickly relaxed her wrists. It broke the tone, or I say broke when I'm talking about extensor tone. It relaxed the tone in her elbows. We were able to bring them back, flex them. When we flexed the elbows, her shoulders came up, her head came up. She stopped drooling. Her tongue came in, and Mom gets to look at a pretty little girl instead of a patient. Now, this is so important for not only her health today, but on an ongoing basis. We've stopped this process before she develops permanent deformity. Now, her knees also were about 30 to 45 degrees contractured. So Mom would take knee splints home and she would wear those while she was in bed sleeping at night. But if you want to look at financially, what have we saved with Alexis? over her whole lifetime. Probably repeat hospitalizations, maybe oxygen therapy, so many things. She didn't, we thought initially she might need a TLSO with the cervical extension to hold her head up. She held it up fine. It was just a matter of identifying where the tone was coming from and what we needed to do. We can always come back and fit her with elbow splints that are for hyperextension. But if mom and her teachers at school can keep her relaxed at the elbows enough to keep them back and keep her shoulders up, that could be all she needs. And it's just a real good example of do one thing and then step back and watch the body's reaction. This is a little girl that I met in China. Excuse me. She was a beautiful little girl. It was a school for kids about that age that had neurological disorders. If you can see her, you can see actually the tension in the left side of her torso. She had severe torticollis, just really that raw neck to the left. Shoulder was held up, elbow flexed, and that typical little cerebral palsy hand. Well, she was in a very, very, very poor section of China. Her parents couldn't afford really anything. They take really good care of their children there. So we found a little wooden chair that she could sit in that would put her hips at 90 degrees. That 90-degree hip flexion broke the tone, relaxed the tone in her torso. Look at her neck. Now her elbow had a little shortened tissue. Look at that right hand that was that little cerebral palsy hand before, and it's relaxed. Now left had a little bit of shortened tissue. If she were in America and we have the health insurance that will cover these devices, we may need to put a TLSO on her to keep her in that good 90-degree pelvic tilt. But as it is, this was fine. She can be in good 90 degrees in that chair and keep the tone reduced and prevent permanent deformity.